Hi everybody! Today I'm going to talk about the current evidence in return to play lower quarter testing. By the end of this video, I would like you to recall the 3 functional tests I talk about that are backed by the most research, and by the end of reviewing my project, I would like you to be able to correctly carry out at least one of the functional tests utilizing the directions on my handout. So although functional return to sport testing is widely used in physical therapy, there are few tests that are actually validated in the research. The tests that I have found to have the most evidence in determining ability to return to sport after an injury are the single leg hop test, medial triple hop, and modified star excursion balance test, or Y balance test. I'll start with the evidence behind the hop test. The commonly used series of single leg hop tests include the single hop for distance, triple hop for distance, crossover triple hop, and 6-meter timed hop. A study conducted by Meyer et al. Found a significant difference in hop distance between the ACL reconstruction group and control group in all tests except the 6-meter timed hop. This suggests a difference in limb symmetry may predispose individuals to future injury. Another study conducted by Monroe et al. With healthy subjects found all individuals to have a limb symmetry index on the 3 tests of greater than 90%. This suggests the need to increase the standard from the original normative value of 85% limb symmetry. In accordance with this, the British Journal of Sports Medicine released practice guidelines for return to sport after ACL reconstruction. They recommend a limb symmetry index of greater than 90% for return to sport and greater than or equal to 100% for return to sport in pivoting or contact sports. Overall, this evidence supports the single leg hop test for return to sport testing. Next, I'll talk about the medial triple hop. The medial triple hop is typically assessed alongside the lateral triple hop. This was the case in a study by Kivlin et al. As well as a study by Hardesty et al. Both found significant asymmetries between limbs with the medial triple hop for distance, but not the lateral, with the first study conducted on female dancers and the second on women's basketball and women's soccer players. Both studies concluded that the medial triple hop can be used to detect limb asymmetries in female athletes. Another study conducted by Dinganen et al. With male and female athletes about 6 months post-ACL reconstruction found significant differences between limbs in the single hop, triple hop, medial triple hop, and medial rotation hop in a large number of the participants. In the medial triple hop, only about 40% of the ACL reconstruction group passed the test with greater than 90% limb symmetry. Overall, this evidence supports the medial triple hop test for determining limb asymmetries with return to sport testing. Another common test for return to sport is the modified star excursion balance test, or Y balance test. A study conducted by Gonal et al. With male soccer players from a professional club found that a greater than 4 centimeter difference between limbs in the posteromedial direction was associated with about a 4 times greater risk in sustaining a lower extremity injury. Smith et al. Found that a greater than 4 centimeter difference in the anterior reach symmetry increased the risk of time loss non-contact injury, specifically in D1 athletes. Finally, another study with D1 athletes by Stifler et al. Found a greater anterior reach asymmetry between limbs in those who sustained a lower extremity injury versus those who remained healthy. Overall, differences in both posteromedial and the anterior reach symmetry between limbs has been associated with lower extremity injuries, suggesting the use of the modified star excursion balance test, or Y balance test, for return to sport testing. Finally, a newer functional test assessing agility is the lower extremity functional test, or LEFT. A study by Brummett et al. Established normative values for the left in D3 collegiate athletes, and also found that a time greater than 118 seconds in females resulted in an increased rate of time loss injuries. Another study by Brummett et al. Found no association with left scores and time loss injuries, but established more normative values in the D3 collegiate athlete population. Lastly, Tabor et al. Established test instructions that allow for good reproducibility of the test and also established good test-retest reliability. Overall, this test can be used to assess agility, but still needs more research to establish normative values in a variety of populations and also determine the association of those values with injury risk. In conclusion, the single leg hop test, medial triple hop, and Y balance or star excursion balance tests have all been researched and provide good evidence in regards to future injury risk in a variety of patient populations. This evidence supports their use for return to sport testing. The left, however, is a newer test that can be used to assess agility, but may require further evidence to establish normative values and injury risk. I have also included in my handout references to other functional tests that have less validation from the literature, including the single leg squat, medial rotation hop, hexagon hop, figure of 8 hop, agility t-test, and the unilateral hip bridge endurance test. Please let me know if you have any further questions or comments. Thanks for listening.